Hi everyone, today we are discussing about ACL. What is ACL? ACL is an acronym for Anterior Cruciate Ligament that is one of the two crossing ligaments within the knee alongside posterior cruciate ligaments. It attaches to the back of the thigh bone and the shin bone at the front and prevents excessive forward movement of the shin on the thigh bone. It also controls the knee during twisting or rotational movements. What is an ACL injury? ACL injury happens when the ligament is torn. The shin bone will slide far forward, especially during some physical activities that involve changing direction quickly, like running and hopping. But how does the ligament get torn? When cutting or sidestep maneuvers are associated with dramatic increases in the varus valgus and internal rotation moments. The typical ACL injury occurs with the knee externally rotated and flexing when the knee is placed in a valgus position as the athlete takes off from the planted foot and internally rotates with the aims of suddenly changing direction. ACL injuries are common in young individuals who participate in sports activities associated with pivoting, decelerating, and jumping such as soccer, football, basketball, and skiing. It occurs frequently in athletics, particularly among female athletes. The only study on the prevalence of ACL injuries in the general population has estimated the annual incidence rate as 1 injury for every 3,500 people, resulting in approximately 95,000 new ACL disruptions per year in the United States. The incidence rate of ACL tears for female athletes ranges between 2.4 and 9.7 times greater than that of male athletes competing in similar activities. There are ways to recognize ACL injury, which are when there is a loud pop or a popping sensation in the knee, severe pain and inability to continue activity, rapid swelling, loss of range of motion, and a feeling of instability or giving way with the weight bearing. Now that we have introduced ACL injury, it's time to know the types of ACL injuries. The grade 1 injury is a mild injury that is caused by only microscopic tears in the ACL. However, these tiny tears will not affect the overall ability of the knee joint to support the body weight even though the ligament will stretch out of the shape. For grade 2, it was a moderate injury in which the ACL is partially torn. The knee can be somewhat unstable and give away periodically when standing or walking. For grade 3, which is a severe injury, the ACL was completely torn through and the knee felt very unstable. As we know, females are more susceptible to get ACL injury than males, and this is due to the slight difference in anatomy. The intercondylar notch at the end of femur is narrower in women than men, and when the knees move, this narrow space can pinch and weaken the ACL. Women also have a wider pelvis than men, and it causes the femur to meet the tibia at the greater angle or Q angle. This will increase the force of the ACL to withstand any twisting motion and increase the risk of damage. The difference in genetic also can put women at high risk for ACL injury. Female muscles tend to be more elastic than male, and it will decrease the protection that the hamstring can provide to the ACL and hormonal changes during menstruation. Female hamstring also reacts and contracts a millisecond slower than male, and it will increase the risk of ACL damage when landing from the tree. Fortunately, for those with ACL injury, there are both conservative and surgical treatments to get them as good as new. Conservative treatment cannot replace torn ligaments, but it may be effective in patients who are elderly or have a very low activity level. Conservative treatments involving bracing and physical therapy. A brace may be recommended to protect your knee from instability. You may be given crutches to prevent you from putting weight on your leg to further protect your knee. And when the swelling subsides, a throughout rehabilitation program is initiated. Specific exercises will help you regain knee function and strengthen the leg muscle that support it. The majority of ACL tears cannot be sutured or stitched together. Hence, the ACL must be reconstructed surgically in order to be repaired and restore knee stability. A tissue graft will be used to replace the torn ligament. This graft serves as a framework for a new ligament to grow on. Graft can be obtained from a variety of sources, which are extracted from the patella tendon, which runs between the kneecap and the shin bone. Grafts are frequently obtained from the hamstring tendons at the back of the thigh. A quadricep tendons, which run from the kneecap to the thigh, is also sometimes used. Finally, an allograft or cadaver graft can be used. Besides that, an arthroscope is used to perform surgery to rebuild an anterior cruciate ligament through small incision. Arthroscopic surgery is less invasive than traditional surgery. Less invasive techniques have the advantage of causing less pain during surgery, requiring less time in the hospital and allowing for faster recovery time. If an ACL tear is treated, it will not worsen. If an ACL tear is not treated, it will worsen rather than getting better. This means that if you seek medical attention as soon as possible after tearing your ACL, it is unlikely to worsen. Things will worsen if you delay treatment after discovering you have a torn ACL. If left untreated, a minor ACL tear will enlarge, causing more pain and increasing knee laxity. Without a properly functioning ACL, the other structures of the knee are subjected to increased strain, resulting in additional injury to knee tissues. According to reports, 80% of patients with an untreated ACL tear develop damage to the knee cartilage, and osteoarthritis can develop as a result of this damage. When your ACL is torn, you have a 50-50 chance of causing damage to the other structures in your knee, including your meniscus. Furthermore, delaying treatment causes extensive damage to the meniscus even if it was healthy and uninjured during the initial event that caused you to an ACL. When the ACL is weak and unable to perform its function, the meniscus is forced to bear additional stress and provide additional support. As a result, meniscus injury are common in ACL tears that go untreated. Damage to the meniscus lead to additional complications, including an increased risk of osteoarthritis. The prognosis for a slight tear of the ACL is that the joint function will be fairly restored, but some physical therapy, rest, icing, and treatments may be required for healing. For the partially torn ACL, it is usually favorable with a recovery and rehabilitation period of at least 3 months. However, some patients with partial ACL tears may still experience symptoms of instability. And then without surgical intervention, complete ACL ruptures have a much worse prognosis. Some patients are unable to participate in cutting and pivoting type sports after a complete ACL tear, while others experience instability during even normal activities such as walking. Some rare cases, there are few people who can participate in sport without experiencing any symptoms of instability. In most cases, the surgery is a success and the rehabilitation goes well, but patients who have surgery must commit to appropriate rehabilitation in order to achieve the best result, which usually takes 6 to 9 months. Even if the surgery is successful, recurrence is likely and complications are possible. You can in fact re-tear the new limb. Athletes suffering from ACL injury may have impairments and functional limitation after reconstruction. They face impairment in terms of body function, which are neuromusculoskeletal and movement-related function, such as the mobility of joints, muscle power, and muscle tone. The loss of knee range of motion can have a disabling effect on an individual's gait. Besides body function, body structure of the cardiovascular system and body structure related to movement, which are the pelvis and lower extremity, can also become impaired. Studies found that individuals with a history of ACL injury had less efficient CV system compared to the control group. However, due to the surgery, athletes only suffer mild to moderate impairment. For functional limitations, the patient may only have mild difficulty in capacity in mobility in terms of walking. The knee will be unstable for a while, but through rehabilitation, the limitation can be overcome. That's all for today's discussions. Thank you for listening.